So coming to the section with standing orders, what are the orders that usually a consultant gives when he's having a ward round and he suspects a patient with diabetes mellitus? So what are the list of investigations and orders that are supposed to be followed by the doctors? So these includes the update of the electronic record. It's very necessary to have an update of all of his investigations regarding his blood sugar on a daily basis. Monitoring the record of blood pressure. So it's very necessary as long as the blood sugar is being monitored. Blood sugar is also important and blood pressure is also important. So these are the both things that are supposed to be updated on a regular basis. Measuring and recording the patient's weight, because patient might go into weight loss, such as patients with diabetes type 1. So it's very necessary to record if he's having any sort of loss of weight. And then HbA1c is a test that is very necessary for patients to have done regularly on the basis of 3 months. It gives a complete picture if the diabetes is controlled with the drugs that the patient is taking or not. Urinalysis and microalbumin testing is very necessary to see if there's any sort of protein or any glucose in the urine, and also microalbumin to see if the kidneys are not affected by diabetes, as it's one of the complications of diabetes. Urine dipstick to see if there's any sort of infection in the urine. Urine microalbumin test, like I mentioned before, to see if there is anything wrong with the kidneys and to assess the functioning of the kidneys. Lipid profile, as we all know that cardiovascular disease is also a part of diabetes mellitus, so it's very necessary to see if the cholesterol level and the lipid levels are among the normal range. Dilated eye examination, like we mentioned before, fundoscopy is very necessary. Ask the patient to remove shoes and socks, and then we'll be assessing the dorsalis pedis, palpating it, and checking the posterior tibal pulses. It's very necessary to check the pulses and the neurological examination. And then to see if there's any sort of skin breakdown, like I've mentioned before, regularly checking if there's any infection of the skin or any sort of skin changes. And lastly, pneumococcal vaccine. As the patients with diabetes mellitus, they're very prone to having different types of infections and they're immunocompromised. So specifically, pneumococcal is the infection that we need to be taking care of, and thus the patient should be having a vaccination of pneumococcal infection. So these are the list of standing orders that the consultant usually give on a daily basis, and these are the things that are supposed to be checked on a regular basis.